are you? My name's Ashley. I'll be your nurse today. I'm going to go ahead and check your ID here. Can you tell me your name? Okay. And your birthday? Okay. Well, I'm here for the doctor's order. They want me to put a nasogastric tube inside you, and it's a tube that's going to go down in your nose and down your throat and into your stomach. So it should be a pretty good procedure. So I'm going to go ahead and wash my hands, do some hand washing. I'm going to give us some privacy, and then we'll go ahead and get started. Okay? Alright. So first thing I can do is I can lower the side rails, but they're really not in my way right now, so I'm not going to worry about it. I need to raise the bed to a comfortable working position. I'm pretty tall, so that'd be good. Also need to put the head of the bed into the high Fowler's position. We'll do that. Okay, I'm gonna assess. First, I'm gonna assess which nair to use for this procedure. So, sir, have you ever had an NG tube before? No? Okay, well, I'm going to ask you to, I'm going to push on each nostril one at a time, and I ask you to blow out the other one, okay? 1, 2, 3, blow, okay? 1, 2, 3, blow. Alright, so both nostrils look good, so I can really just pick one. I'm gonna use your right nostril today, okay? Alright, so now I need to gather all my supplies for this procedure and have an NG tube, which I'm going to go ahead and clamp up this bottom part so that no gastric materials come out. And I'm going to go ahead and put my gloves on too. To put this right here on the bed while I get my other supplies. Got some lubricating jelly. I'm gonna put it right here on the discarded little package where the tube came in, so that's fine. Just as long as I don't put it like on the table, it's good. I have this for later. And I have my tape, which I'm going to go ahead and rip off. And I'm actually going to rip off a couple of extra pieces just in case something goes wrong in the procedure and I need a couple of extra piece. I don't want to have to. I only have 2 hands, so kind of have to get ready for accidents. Let's see. All right. So we've already determined what nostril we're going to use. So now we're going to start the procedure. I'm actually going to coil this up a few times around my finger because we want it to be flexible when it goes in, but we don't want it to be too flexible. So, and the first thing I'm going to do is I'm going to measure for the length. So I'm going to measure from the nose to the ear, and then from the ear I'm going to measure down to the stomach. So about right in here. Yeah. Okay. So with that, I'm going to put a piece of tape on that place to mark it. I can also use a marker, which probably might actually be a little bit easier. We don't have a marker today, so we're just going to use a tape. Alright, now I'm going to go ahead and put this over my patient's lap so that nothing gets on him. Okay. And then I'm going to give him this basin. Sir, here is a basin in case you feel like you need to throw up or, you know, spit or anything like that. Just throw up in here. I'm also going to give you this cup of water. We'll use this in just a minute, but I am going to give it to you. Okay, so fixing to put it in his nose. First thing I would ask him to do is tilt his head back. Oh, actually, the first thing I need to do is put some jelly on it so it's a little bit easier to go in. Alright, so now I ask him to tilt his head back, and I'm going to start advancing it until I feel resistance. So here's the resistance. Now I'm going to ask the patient to I'm going to ask him to swallow water while I'm advancing the tube down into the stomach. And also, I'm also going to ask him to flex his head forward. So when I say swallow, he swallow, and I'll push the tube in. So swallow, 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 swallow. Okay. If I'm at any resistance, of course I would take the tube back out, give him a rest, and start again. But that's pretty much where it's going to be in this little tube. I didn't get all the way down to my marker, but it's kind of hard to do in this dummy. But, okay, so next thing I would do is check to see if it was in the right place. So I would ask the patient to speak. So, sir, can you state your name? Okay. Also, I would make sure to look and see in the back if the tube was actually in the spot. And of course, I would have a tongue depressor. I wouldn't put my fingers in there, and it is actually, I can see the tube, so I know it's in there. Next thing you do is, for right now, you can tape the tube to patient's cheek. It's just for a few minutes while I make sure it's in the right spot. Now we're going to clamp the tube. Make sure we got to do that. And we're going to put this in here. We're going to draw out some gastric fluid, noting the color should be green if it's in the stomach. And then we can take this out, clamp this back in here like this for just a minute, and then we would test the pH of this material. So get a strip out of this bag. Sorry. Okay. So we take the pH strip out, and it would be like a whole kit, and then we put just a little bit of gastric contents on there. And if it's between 1 and 4, then we know it's in the right range, so that's okay. If it is in the right range, we can actually clamp the tube back and put the gastric contents back in. And clamp it again. So we know that based on our test, it's actually in the right position. So now we can cut this tape, which obviously I think I should have done before. My gloves on. do with this is I have some benzoin that I could put on his nose to make the tape stick. I'm not going to worry about that. But I am going to put the tape on his nose. Put this piece like right in here for just a minute. And then I'm going to take it off his cheek. And wrap it around like this. This might actually take a minute, and I'm also really careful with the patient. This probably hurts. It's a little bit uncomfortable. And then I take this piece of tape and I would wrap it around the other way. Okay, sir, does that feel comfortable? Yeah? Okay. I would also clean up my area. And then, because he's going off for x-ray, he needs an x-ray to make sure that the tube is in the correct place. So, to make sure that the tube's not falling around, we'll put a piece of tape on his gown to kind of secure it with him. And we would send him off to x-ray to make sure it was in the right place. At this time, I would clean up my supplies, throw my jelly away, clean up everything, take my gloves off since I'm done, perform hand hygiene, and the last thing I would do is I would go and document how many attempts it took. Obviously, I was able to get the tube in one try. I used the right air. The gastric contents were green, and the patient did not have any problems with the procedure. So if he did have any problems, of course I would note that. And also, we need to verify that the x-ray was right and the tube is in the right place. So that's what I would do. Hey, how are you? My name's Ashley. I'll be your nurse today. I'm going to go ahead and check your armband here. What's your name? Your full name? Okay, what's your birthday? Alright. Well, today we're actually going to take your NG tube out. It is a very quick procedure. You shouldn't have any trouble with it. I know that you're probably going to be glad to have that out. So we'll go ahead and get started with that. I'm going to go ahead and close the door, give us some privacy, do some hand hygiene, and we'll get started, okay? Yeah. When I come in the room, first I would lower the side rails, and I would raise the head of the bed up, or raise the bed up to a comfortable working height, and then I would raise the head of the bed up. So, but it was already done. So. All right. So first, I would put on gloves, get all my supplies ready. Sir, I'm gonna put this linen saver on you, so that you don't have to worry about getting any mess on you. First, got this tissue. I'm going to hold this. First, I'm going to untape it from the patient's gown to get some room with the tube. I would also need to unhook it from suction if it was turned on. Get this right here. And I'm going to put this tissue under here. Sir, when I say, I'm going to count to 3, and when I get to 3, I'm going to need you to draw a deep breath and hold it in as I'm removing the tube, okay? Alright, so I take the tape off his nose, and I say 1, 2, 3. Patient draws in a breath, and with one quick motion, I take the tube out. And it doesn't have to be too fast or too slow. And now clean his nose. Get this all up in here. This goes in a red biohazard bag for disposal. And then I'll get another tissue and clean his nose. And I would offer a warm washcloth to clean up with. Sir, do you need a warm washcloth or anything else? Okay. So